Welcome to Live Better Longer. I'm your host, Bill Borton. Healthcare in the U.S. is chronically ill today. People are living longer, but not necessarily better. My guest today is Dr. Joseph Carchedi. Dr. Carchedi is the CEO of the Vitanova Group and the founder of Lower Gwynedd Functional Medicine. He began his career over 25 years ago as a physician in internal medicine and emergency medicine. He later added sports medicine by providing medical support for multiple professional cycling teams. He now specializes in integrative health and functional medicine. He's been concentrating on detoxification and nutrition. He tailors individualized programs for all his patients, combining aspects of traditional and functional medicine to maximize performance, health, and overall wellness. Welcome, Dr. Carchedi.
Yeah, hi there.
Pleasure to have you here.
Pleasure to be here.
So, tell us about the current state of affairs in healthcare in this country today.
It's actually not very good, but I do like to mention off the top that we in this country have probably the best acute care medicine in the world. Mm-hmm. If you have a ruptured appendix, it's really, really good because you can take care of it. However, the majority of most of our presentations or symptoms are chronic in nature. And the system, the way it is structured today, it really doesn't address those type of things. Having worked in the ER for many, many years, I saw that the individuals were coming over and over and over again without getting any resolution. We were just basically putting a little glue in the dike, and then it would make another crack, and they'll come over and over again. So I was able to find this out because after seeing patients over and over and over again, I stated to myself, what can I do to help these individuals? And the interesting thing about it, I have a little tidbit, that I saw a patient for actually 20 minutes. You cannot do that today to see a patient for 20 minutes. And I was kind of ostracized because I spent so much time with the patient trying to get information. Today, the major complaint of most people that they go to a doctor is they don't listen and they don't spend time with the patient. And that frustrates every patient out there.
They're looking at the chart, not at the patient.
Exactly. And we are now in this technology that they're actually looking at the computer, the iTab, mm-hmm. the phone itself. So what I decided to do is to change this whole model, okay, not me particularly, to follow this change of this model, so I'm able to see this type of patient and actually help them find the root causes of these problems. Medicine today is not like that. Over and over again, I speak to physicians, and they said, well, I just treated them. I said, what do you mean? They said, well, they have a high blood pressure, and they give them a pill. They have high cholesterol, they give them a pill. Instead of sitting down and thinking to themselves, why do we as physicians understand that when we were younger, the person at 15, 16, 18 years old is perfectly normal. And all of a sudden, at 50, we have problems.
Well, except it's not all of a sudden, it's been building up over time.
Exactly.
And so the symptoms start presenting at some point, but the person's been chronically ill for years.
Exactly correct. So by way of what I'm doing now is trying to find out the actual causative factor that has led the person to come to this place. The only thing in medicine today that's really very helpful is actually surgical procedures, things of that nature. And we are the best of the best in the world regarding that. We have technology at the wazoo. However, that technology does not help the chronicity of how we present, mm-hmm. the autoimmunity that has been increasing, the ability to try to affect and try to change the journey of life back to the way it was from before.
Well, most chronic illness, we do it to ourselves through what we eat and through the medications that we take and through a sedentary lifestyle. And so really, again, the symptoms present at a point in time, but we've been building up to this for years.
That's entirely correct. But we as a society don't want to accept that. Mm-hmm. It's very, very difficult to say to somebody, well, you're a president of a company or the head of a family and say, listen, I need for you to change your lifestyle, change your eating habits, be more active, and you don't have time to do that. So you want a magic pill. Unfortunately, there isn't a magic pill because the time that created where you are will probably be the same amount of time for you to get back to where you need to be. Mm-hmm. And that's what we need to do.
Well, so somebody comes to you and you take their blood pressure and it's way above 120/80, and if you're a typical physician, you're going to prescribe one or two drugs for them. and probably say something like, you're going to have to take this for the rest of your life.
That's entirely correct. But the fact of the matter is, we are taught in medical school, okay, the number one therapy is first try to change the behavior and the nutrition. And most physicians today don't have the time, here we go again, to do that. So exactly what you just said, we give a pill.
Well, so they don't have the time, though, because the third-party payer, whether it be Medicare or an insurance company, won't provide them with a reimbursement sufficient to cover the time.
Oh, that's very, very true. Since the system, the Medicare system came into play, the time allotted for patients has decreased, if I'm not mistaken, from a 30-minute visit down to a 7 or 8 minute visit. And that's all you're permitted. And if you, as a physician, see the patient for longer than that time, it's on you, unfortunately.
So we're going to take a break for a word from our sponsors. We'll come back with more with Dr. Carchedi to talk about what people can do about these issues. I'm Bill Borton. We'll be back with more Live Better Longer in a moment.
When did you see the sign?
When I needed to jumpstart sales.
Build attendance for an event.
Help people find their way. Fast Signs designed new directional signage.
And got them back on track. Get started at fastsigns.com.
I'm Casey Price, host of a brand new show on RVN TV called Justice for All. Tune in every Tuesday at 1 p.m. as some of South Jersey's amazing attorneys share their stories and important legal information that could affect you and the people you love. Remember, that's in Justice for All, every Tuesday at 1 p.m., only on RVN TV.
Is your business growing and now you need a new and bigger building? Has your organization outgrown their facility and now it's time to expand? Do your hobbies require the need for more space? If you're paying rent, but now you want the advantages of owning, the prospect of financing, construction, and on-time completion may seem out of your reach. General Steel Corporation has the answer. A pre-engineered steel building from the General will not only look great and satisfy almost any need, but you'll save time and money. Our team will help you create your building and deliver it to your location. We offer design services to help you present your concept to board members, bankers, or for fundraising. And the General can even help with financing. General Steel is a name you know, with quality backed by a 50-year structural warranty. Call today and find out how easy it is to have the building you want. You may even save up to $20,000 with rebates. If you need space, you need the General.
Welcome back to Live Better Longer. I'm your host, Bill Borton, here with Dr. Joseph Carchedi. And doctor, tell us, what options do people have these days to traditional Western medicine?
Well, we're in a situation right now that since, through no fault of anyone through the system, that the traditional physicians have very, very little amount of time, your obligation is basically try to find somebody who will spend time with you to figure things out. You could call this like a Sherlock Holmes type of approach itself. But with that in mind, there's nothing out there supposedly to do that type of stuff. So there are methods out there right now that through a founder that found this functional medicine, and I was just going to explain this to you because of the fact that this whole process kind of reverts the way we went back in the 1950s when we had our local physician. They would sit down with you and discuss things. The difference is the fact that instead of being totally integrative as they think of from one extreme or functional, it takes into play, functional medicine takes into place the root causes of things while applying medical models. You do blood tests, you do all the things that you need to do to find out what's wrong with the person's self, but with that in mind, we do an extensive questionnaire, about almost 50 pages long, to the detail of genetic studies, family, environment, things of all that nature, and this takes time. You cannot do this in a 5-minute period or 7-minute period. So we sit down for almost 2 hours, if not longer, and talk about every nuance of an individual's journey of life, how they were born, where they were born, environment, have they traveled. All these type of things are a little bit of the picture that makes the person who they are. And that you need to decipher, because every little thing adds up and can possibly make a perfect storm, whether it be an autoimmune disease or a cancer presentation or whatever it may be. And we try to decipher that.
Is integrative and functional medicine something that is becoming more widespread and it can be found all over the country at this point?
That's interesting you say that because of the fact that I remember reading in the literature a number of years ago that the American public is so frustrated with the traditional orthodox medicine that they have decided, and they've been doing this, and there's research into this, that they're going to be spending almost $1 trillion out of their pocket for integrative functional medicine and supplements because they're frustrated with the system that doesn't work.
Well, they're sick and tired of being sick
and tired. Exactly, yes. Yeah, that's very, very true. So yes, there is a community of almost 1,000 physicians in the functional medicine arena who are certified in this approach that actually do this entire process, find out exactly what the causes are, the root causes, find the roots, look upstream. It's not that we're not looking at the symptoms. The symptoms are always the consequences of the upstream issues. So if we find out the root causes, everything falls into play. Nature is wonderful. And once you figure it out, it goes into flow and your body gets back to a balanced state.
Well, everything in life is cause and effect.
Yes.
But you don't treat the effect. That's the problem.
That's what we've been doing.
You need to treat the cause.
We've been doing that, unfortunately.
And the cause frequently is lifestyle related.
This is true.
So interestingly enough, if you think about it, a lot of Americans now have very expensive health insurance. It may be expensive to pay the monthly premium through your employer or on your own, and it probably is very expensive to use it because people have high deductible plans. True. I'd be willing to bet that somebody could come to you and receive the kinds of services that could really help them find out what's wrong and get well, and maybe even stay that way, with the amount of money they'd be shelling out of pocket for their high deductible anyway. That's
most logical. It's probably very, very correct. Unfortunately, our approach as of this point, and we're hoping that it changes in the next 10 years, it's not paid for by the insurance companies. We spend a lot of time, and insurance companies don't want to spend for a lot of time.
Well, your lobby is not that strong, but see, the grassroots bottom-up approach, I think, is what's going to end up helping to change the system over time.
We are still trying to make sure to do that, and we're trying to promote ourselves accordingly.
So are there other modalities that you're aware of that can also be beneficial as alternatives to Western medicine?
There's a lot of different modalities, in fact. The issues of trying to find out the systems is what we kind of do, but there's other approaches itself that have their appropriateness in certain conditions.
So like you might,
chiropractor.
You determine what the issue is,
exactly.
And then perhaps chiropractic or acupuncture could be helpful.
Yes, sir. Yeah.
Okay, yeah. Understood. So do you have to go through special education and training through some type of an organization to become an integrative and functional medicine specialist, or is it more or less self-taught?
No, actually, initially it's a little bit self-taught. Being a physician, being trained in the conventional model, and having segued into functional integrative medicine, we have to take a board certification in integrative medicine, as well as certification in functional medicine to update our approach, because we've been so used to having the old approach. It's a totally different model. You see, we don't look at the tree, we look at the forest. Today, orthodox medicine sees the heart, the lung, the liver, and things of that nature, and they separate all these organs together. We don't do that. We put them all together in a web-like fashion and make you who you are, and what impact it has on the entire forest.
The human body is basically a skin bag that contains, what, 50 to 70 trillion cells?
Actually, almost 100 trillion cells. No, excuse me. The human body contains 10 trillion cells. However, the human intestinal system contains 100 trillion cells.
Which aren't
bacteria,
actually in the body.
And not in the body, right.
Yes, and so the body actually needs the bacteria
Absolutely.
in order to function normally, which is one reason why antibiotics are not necessarily a good thing.
Right.
Because they kill the good bacteria.
We're all, in this venue that we do, I do a lot of looking at the gut. I try to find out what's wrong with it. In the gut is the immune system. In the gut is the digestive system. If it's not working properly, then that's what happens as far as it doesn't help you. And usually what happens is the fact that the immune system doesn't work, you get infections, autoimmunity, and it goes on and on.
Well, when you think about it, if you're eating a typical Western diet with fast food and sugary drinks and pizza and cheesesteaks and things along those lines, and eating things that have canola oil and high fructose corn syrup and all sorts of other wonderful things, that all goes into your gut.
Yep, exactly.
And if your enzymes and the good bacteria aren't capable of dealing with it efficiently,
Consequences happen.
yes. How about that?
Yes.
Again, that cause and effect again.
Exactly.
Interesting.
Yes.
So you mentioned having to go back and be certified in integrative and functional medicine. Is this becoming again more popular, or is it becoming more mainstream for physicians who are looking for a better way and making that choice as you have to be able to go and get those certifications?
I find that of my colleagues that have been frustrated the way I have been, they wind up making that choice. They try to go into it, they update themselves. It's from that standpoint, and then what they do is they either stop altogether what they're doing from before because they see the reality of it all, that we actually are helping. It just that they need time and actually effort to do that.
Interesting. Well, we're going to take another break for a word from our sponsors. We'll be back in a moment with more Live Better Longer.
Got a quarter?
Hi, I'm Ray Lowe, the luckiest guy in the world. Our new show, Breaking the Rules, is for those of you who are entering the next chapter of your lives. If you're thinking about retirement or changing jobs, or maybe you just want to like your job more, or you're going back into the workplace and you've been away for a while, this show is for you. And Breaking the Rules is about not having to do things just because they've always been done that way before. If you need to reinvent yourself for any of these reasons, join us and our experts as they give you the tools and techniques to get the job done and make you happier. Join me, Ray Lowe, the luckiest guy in the world, for Breaking the Rules every Tuesday morning at 10 a.m.
When did you see the sign?
When I needed to jumpstart sales.
Build attendance for an event.
Help people find their way. Fast Signs designed new directional signage.
And got them back on track. Get started at fastsigns.com.
Welcome back to Live Better Longer. I'm your host, Bill Borton, here with Dr. Joseph Carchedi from Lower Gwynedd Functional Medicine. Doctor, how do people get in touch with you if they would like to talk to you or come see you?
Well, there's actually two significant areas you can do that. Obviously, when in doubt, you can always Google. So what you can do is you can Google functional medicine practitioners. There is a website that, through our certification, that gives you how to find a practitioner. So you can go to ifm.org, and you can put in your zip code, and you can find a practitioner local to your area, which is more convenient for you.
Okay.
In addition, there are other, if you Google integrative medicine physicians in your area, they do the same thing. When you go on the website, you'll be able to see what different approaches that they do themselves and what they offer from that standpoint.
Now, if somebody wants to see you, how do they get in touch? What's your number?
Oh, my number is 215-780-1898. And the front desk will be more than happy to make an appointment for you. My approach is a little bit different because of the fact that I want a lot of information. And to save time, since we're already spending 2 hours time anyway, I want to even save even more time because I want to do a lot of information. So I send an email out, a 3-part questionnaire email, very, very detail-oriented, to give me a sense of where you are before you come, and ask you if you could bring also some information from your previous encounters with either physicians or other practitioners themselves.
Some benchmark information.
Exactly, exactly. So when you arrive at the office, you check in, the front desk area, she's a wonderful person. She'll give you just a release information. It is an office. So it's a physician's office, so it's 100% privacy, HIPAA compliant. So that's one thing that we have to underline. And then I always give everyone a glass of water if they want to. I have them sit down, and we sit down in a very, very comfortable environment for about 2 hours, 2.5 hours, and I ask all the things that I can from the questionnaire, plus the things that the individual has issues with. my first question is not typically conventionally based, meaning, what's wrong with you? I ask, when was the last time you felt healthy? And that's where I start the entire discussion.
Well, that's an interesting question, because I always like to say good health is not the absence of symptoms.
Correct.
So everybody, I have clients that are in their 50s and 60s, and they'll say, well, gee, Bill, I want to talk to you about long-term care.
Right.
And I'll say, all right, well, I'm going to send you a brief health questionnaire, but, would you describe your health as, as excellent, good? Oh, my health is excellent. And then I get the health questionnaire, and there's 5 prescription medications that they take daily.
That's very interesting. I had a lot of patients tell me, I have nothing, and then I see that. I say, well, why are you taking that? Well, that's controlling this. But why are you taking that? That's controlling this. It's interesting, like, why the individuals go to a practitioner and they give them a pill, and all it does is block the things. Mm-hmm. If you really think about the actual presentations of individuals, if your cholesterol gets high when you're 50, and it was normal when you're 15, it's not that you need a cholesterol drug like a statin to lower it down. What was normal at 15 that it's not now, and that's what we try to figure out. So when they sit down, we discuss all these things, little nuances, social issues, environmental issues, where you've traveled, fresh water, whether you were breastfed or not, things that say, why are you asking me these type of things? It's interesting that little of these things have very much of an impact.
So in addition to gathering all kinds of information, what kinds of tests do you do with people to help them help you?
Well, being a regular physician, I do blood tests with local laboratories that are allocated for everybody. As I told you, I do concentrate on the gastrointestinal system because that's where the immune system is located. The majority of times I do stool testing or gastrointestinal testing. I can do autoimmunity testing. I also try to find out the nutritional value or the level of the person to find out just because you're eating well, just because you're doing the right stuff, is it getting into your body? And I assess that to see, well, you may be taking enough vitamin D, for example, but your level is very low. Let's find out why.
In the few moments that we have left, I want to change gears a little bit, and I want to ask you about something that I think is very important, and a lot of people think is controversial around this country, and that is medical marijuana, cannabis. And I know that the state of Pennsylvania, where you practice, has legalized the dispensing of that under certain circumstances. I know New Jersey is in the throes of trying to do it right now, and it's still federally illegal.
Correct.
Which creates some potential challenges. But tell me a little bit about your thoughts.
Medical cannabis has been ongoing research. They need more research, but they have found that it's been very, very helpful in a number of different types of scenarios. In Pennsylvania, there are approved conditions, and the ones that are most popular to be seen by certifying physicians are cancers, pain controls. We're in a heroin epidemic, the narcotic epidemic. These things actually help people decrease their symptoms, and I use the word decrease, not treat, decrease their symptoms so they can deal with it and correct whatever needs to be corrected. And it's very, very helpful in a medical controlled environment, and that's what the state of Pennsylvania has done.
Well, very good. Well, I want to thank you for being on the show. Time flies when you're having a good time. It's been a pleasure, Dr.
Absolutely.
Carchedi.
Been a pleasure.
Until next Tuesday, this is Bill Borton. We'll be back with more Live Better Longer on RVN TV next Tuesday at 11. Thank you very much. Have a great week.